In today's day and age, doctors no longer hold the keys to medical information, and this is both a good and a bad thing. We need to promote health literacy, here defined as the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. However, it isn't just essential for our edification. Having adequate information about health conditions can lead to better health outcomes. We can infer from this that people who successfully search for and find information about their health conditions tend to be healthier than those who do not. This is reinforced in Weber. The internet could provide an efficient channel for primary health promotion and disease prevention activities, encouraging many individuals engaged in health information-seeking behavior to maintain a healthy lifestyle. First, some brief history. Until the advent of the internet, and outside of consulting a doctor, people were largely forced to read medical texts or converse with others for medical information. Home remedies were passed down from one generation to another. Many people consulted television, mass mailings, or flyers. Libraries were also used, though not terribly frequently, and many of these methods are still in use today. It is estimated that 10 million American adults use the internet to find health information on a daily basis. Websites like PubMed, WebMD, Medline Plus, and Hippocrates came into being, grew in stature, and became useful to doctors as well as patients. The internet is by far the most popular non-human information source, although this of course presents its own set of problems detailed in the references. Many folks took to more conventional search sites, though there is always a problem with accuracy and reliability with these. And as we can see with this questionable Lincoln quote, things are not always as reliable as they seem. Where is this road taking us? Internet connectivity is expanding, but what do we do about people who do not have internet connectivity, like many senior citizens in this country? One topic that we studied at length in class was the primacy of the digital divide, whether across cultural, poverty, or age lines. Many people do not have access to the internet, or if they do, are not able to make use of its many virtues with proficiency. Wang et al. Reinforced this, stating that health information-seeking behavior, particularly on the internet, is less frequent among the elderly, probably due to the higher perceived barriers, poor health literacy, and a lack of interest in self-health management. Those that prefer their information from a human could be at a disadvantage going forward. How can we get these folks information about their health? A solution may lie in this. Favorable relationships with local primary care providers, and in particular with local general practitioners, engender trust, self-confidence, and the enactments of choice in relation to health information retrieval. Most of the papers reviewed for this digital story note the importance of this trust and the still relevant impacts of a personal touch in health information. We infer that people are in favor of having a choice when it comes to their health information, that they like to have both a person and a computer or other source to go to, that the internet has not gained a sizable advantage over the impact of a human, at least yet, and at least for the elderly, and they are stronger in concert than separated. So let's examine how many senior citizens get their health information. When they congregate for activities such as chiropody, they talk. They exchange information with each other, vetting it to decide whether to act on it or not. As Pettigrew reports, health information did not just flow between nurses and seniors receiving treatment, it also flowed between seniors and other seniors. She also reports that information was shared in a much more passive, organic way as people began conversing and slowly arrived at some piece of information that was relevant. It was not the opening topic of conversation. This illustrates, in a somewhat roundabout way, the primacy of the older methods of information processing and movement among those without internet access. Flow of knowledge is not based around looking for a specific thing and finding it instantly, but instead chatting with someone, building a connection, and eventually arriving at something useful. Unconnected people use others as touchstones and bridges to the wider information world. As Pettigrew puts it, the clinic may best be described as an information ground, from which emerges a social atmosphere that fosters the spontaneous and serendipitous sharing of information. The more information there is, the more we need to consider the ratio of information to quality information. As Perchesky and Hargitine note, information is a valuable resource mediating the relationship between social status and health. But this information must be found and vetted extremely carefully if we are to avoid poor information outcomes due to the unregulated nature of the internet. This is especially relevant when the internet's information is accorded the kind of importance that Eisenbach gives it, that of verifying what a physician says. Approaches need to be taken to make sure that information reaches people in the most effective way. For example, we have to understand the ways that people of different races and ethnicities will seek information, and see the references for more detail here. According to Perchesky and Hargitay, that web use for health information is higher among students with greater internet skills suggests that the internet will not necessarily equalize information access and may enhance or perpetuate other inequalities in information access and use. However, the ubiquity of the internet and internet use is so pervasive that they are still able to suggest that the web may alleviate some types of information inequalities. The papers reviewed for this story have one thing in common. There is almost no constancy in the ways that people seek for health information. There are so many factors that play a role, from parental and personal education levels to ethnic background to traditional modes of health information seeking. The main thrust to take away are that the internet's ubiquity would serve people nicely, at least as a complement to the kind of personal face-to-face interaction that they are used to and that engenders trust and comfortable exchange of information. The more that we make things appealing to people on an individual level, the more that people will be able to realize the future talked about in many of the pieces for this story. Better health information seeking leading to better health outcomes.